Good morning. Welcome to our webinar today, where we will be discussing the topic of enhancing healthcare security with real-life staff safety solutions. A bit of housekeeping before we get started. Your microphones will be muted during the presentation. However, you're welcome to use the chat function to ask any questions. We will leave time at the end to answer as many questions as we can. We are also recording the session today, and we will be sending out the links of the recording by the end of the week. And just to get started, so our presenters today are Carrie Brock, Head of Healthcare RTLS here at HID, and Joanne Scalise, our Director of Customer Success. Joanne is also a registered nurse with over 30 years of experience in trauma, neonatal critical care, quality, and leadership, with a core commitment to patient safety in every experience. I'll now pass things over to Carrie to get us started.
Thank you, Matt, and we appreciate you taking time out of your day to spend it with us over this next hour. Our objectives today are to give you a brief overview of what we think the current state of safety in healthcare is. We're going to help you quantify the costs of deploying a system for staff safety at your facility. We're going to talk about how to prioritize the prevention of violence in healthcare settings. We're going to offer you some recommendations on how to design and plan for these systems. We're going to explain to you the RTLS and the BLE technology. And we're going to explain these terms and give you some takeaways so that you can be more familiar with the technology itself. We're going to explain how that integrates into your facility, how you can enhance staff safety and make a better workplace for your employees. And we're going to support you how to be that champion to work on violence prevention, because really what we'd like to see is a reduction and make healthcare a safer place to work. I'm going to tell you a little bit about us. Our parent company is ASSA ABLOY. You may or may not have heard of ASSA ABLOY, but if you go back to your facility and you're looking at your doors or your locks, I imagine you'll see some of our equipment deployed there. Once you see it, you'll see it in many places. Yale is another brand. So that's our parent company. We operate in over 70 countries. We have over 61,000 employees. HID Global, that's the business area that we're part of, and we're based out of Austin, Texas. We have about 4,500 employees globally, and our core products include RTLS, but also we're very well known for our access control. We have about 80% of hospitals use HID access control. So again, if you flip over that ID badge or that key fob, you may see our logo there, and then you'll say, oh yeah, now I recognize that brand, and you'll see it in many places. Our business area is called Identification Technologies, and within that business unit, we manufacture and design all the readers, RTLS hardware, the tags, RFID, passive RFID, active RFID, anything to do with identification technologies comes out of this particular IDT business area that we're part of. Healthcare for HID is an extremely important vertical market. So it's an area that we're investing in. It's an area that's growing for us. And specifically in the RTLS use cases, which is the team that I manage. We've been doing some acquisitions lately. So I came from a company called Guard RFID. We're well known for our infant security product called TopGuard. And we were acquired in 2023. We then acquired a company called Connexient, which specializes in wayfinding for healthcare. It's the only vertical market we support with that product. And then most recently in July, we acquired a company called Vizia Technologies, which also is a healthcare specific technology for asset management and environmental and temperature monitoring. So we continue to build out this team, and we expect that we'll grow significantly more over the coming years. So we are a global leader when it comes to identifying and tracking. We do that for billions of things all around the world, and specifically in healthcare. Today, we're going to talk about use cases that are relevant to hospitals and most specifically staff safety. When you work with us, you have that assurance and financial stability that comes from ASSA ABLOY, our parent company. And we also provide multiple use cases, and everything that we're going to show you today has been purpose built for healthcare. We're not taking a technology from another industry and trying to make it work in healthcare. All these products The roots were in healthcare, built by people that were familiar with healthcare settings, that come from clinical backgrounds and have knowledge and expertise in these areas. We're going to toot our own horn here just quickly. Gartner is an industry analyst. They prepare a report annually called the Indoor Positioning Report, which looks at all RTLS vendors of a certain size. You need to be over $10 million in revenue to be included in this report. This year we finished in the top. We were the leader in the Magic Quadrant, as they call it. So you want to be in that upper right-hand quadrant. And it takes a look at who they think have the ability to execute and who has a complete vision for the market. And one of the things that they pointed out and thought that we were making very good decisions on was our acquisition strategy, plus the solid base of customers and expertise that we had. So we were pleased with that. If you want to read this report, let us know and we can send you a link so you can have access to it. I'm going to cover off a couple of key terms. You'll hear us say BLE. That refers to Bluetooth Low Energy. So that is the Bluetooth that connects, say, your phone to your AirPods or your Apple Watch to your phone to your car. Same technology. RTLS is real-time location system. That refers to a system that will locate either people and/or assets. Gateways, those are the devices that actually collect and transmit the data from the tag or the badge or the sensor, and it takes it to a central system for processing. You'll also hear those devices referred to as readers. So that's kind of an interchangeable word there. Same thing with beacons. So the beacon is going to be your badge that you have or the device that you're wearing that sends a signal. Some people refer to those as badges or tags as well. Same thing. It's used interchangeably, but the technical term for it is beacon. A Wi-Fi access point or a WAP, that is your Wi-Fi network within your hospital. These also can have BLE capabilities, which means they've been enabled to use BLE, and we'll talk about why that's important later. And the gateways communicate to the Wi-Fi network to send their information back. They're wireless. In most cases, there are some cases where they're not, and I will touch on that when we get to the technology section. Beaks, BlueFi, and Blue Zone, those are simply HID product names. So Beaks is a beacon, BlueFi is a gateway, and Blue Zone is the cloud software that helps you manage the beacons and the BlueFi gateways. And if you have any questions about the technology, pop it in the chat. Matt's going to be monitoring that, and we'll make sure that we cover that off. So I thank you, and I will pass it over to Joanne to get us into the really important content today.
And as I start, I want to add my thanks for joining us today. We know you are extremely busy, and the fact that you are here demonstrates your commitment to staff safety, and we honor that. Thank you. We know you have incredible challenges in healthcare. There are challenges and priorities that need to be set by organizations. And how do we make these choices? How do we prioritize when we have so many things to manage? And in fact, sometimes we can't prioritize. We have to do what's in front of us. But what comes to the surface most often is staff safety, patient safety, staff shortages, because we know we are in a crisis right now as it relates to staffing throughout the healthcare organization. It's not just nurses, it is lab techs, it is radiology techs, it is everyone who serves the patient at that point of care and who helps support the care environment. So it's necessary that we are able to make those decisions and make it with partners who can support us. And all of these challenges are areas that we have developed use cases for to be able to support organizations in solving these challenges. And throughout all of that, we have to provide a positive patient experience. And it's patient experience, but we also have to think about our staff with that too, so that we can retain them, so that they can continue to find joy in work. And so with all of that, we appreciate the work that you're doing, and you're taking the time again to be able to look at staff safety within your healthcare environment. There is an incredible amount of violence in healthcare, and we know that. I'm sure everyone has seen the reports that are on an ongoing basis. 75% of all workplace assaults happen in the healthcare space. It's usually a healthcare worker or social services, and that is, in some ways, essentially the same. In the time that we are spending together today, 2 of our colleagues will have been assaulted. That's horrific when you think about it. And another critical component that is also very challenging and terrible for healthcare is that 30% of nurses are considering career changes because they can no longer manage the threat of violence in their workplace. And when we think about how we will provide the care and the service excellence to all of the patients who enter our healthcare system, and we don't have that core group of professionals to be able to do it. We're already in a very critical space. And then to think that people are leaving the bedside because they are fearful, that is something that as organization leaders, we have the opportunity to make some changes. So we have to think, where does this violence come from? Where is it all happening? Well, that's an important question. What's more important is that whatever it is responded to in the same way. Of course, much of the violence arises from patients as well as patient families. People are often stressed and excitable and very vulnerable, and sometimes they act out. Unfortunately, there is also the potential for coworkers to be contributing to violence in the workplace. And violence in the workplace is also considered to be aggression, bullying behavior, communication that is less than respectful. So all of this is considered violence. And for us, we are focusing more on that aggressive and assault type of behavior. One other significant and worrisome fact is that there is a significant number of domestic violence that happens in the healthcare workplace where a partner will come to the workplace and then act as a perpetrator to inflict violence upon their partner. So those are things that also have to be addressed and people need to be protected from. So we know that one of your most prominent priorities is that of protecting your people. So in addition to protecting your people, you're also protecting your organization. There is an incredible cost, over $2 billion, that is anticipated to be lost because of missed days of work, legal expenses due to litigation, workers' compensation. That all adds up to an incredible amount of money that organizations cannot afford. More than 50% of healthcare workers claim they've been victims of workplace violence, and yet at the same time, the ANA says that over 80% of nurses do not report workplace violence for a variety of reasons. We know that nurses are the biggest component of your workforce and how expensive it is to attract, recruit, retain these professionals. It costs over $100,000 per nurse to hire that nurse, to get them to that point of where they are a contributing staff member. And just the recruitment itself can result in tens of thousands of dollars of expense for every organization. And then within the hospital, as we're looking at these technologies that can monitor and give location tracking to people, and we don't usually say we're tracking people, we are managing and observing so we know where they are when they need assistance. But in terms of assets, there is an incredible cost also attached to nurses and other healthcare workers looking for things. It can be over $4,000 a day per hospital. There was a study probably about 15 years ago that Johns Hopkins did, and it found that nurses could spend up to 40% of their time looking for things. Well, when we think about nurses practicing at the top of their license, looking for things probably does not fall into that range. So we want to be able to make certain that we know where our people are, we know where our resources are, and that we're able to manage much more effectively and cost efficiently at the same time. And it makes people happy to know that they're doing what they entered the profession to do, and that's to take care of people, not so much things. What we want to be able to do with you, our shared vision, is to partner to improve the safety of your people. And we can do that by helping you implement a system that has to be reliable, it has to be secure, and we know it has to be cost effective. You don't have excess money for anything that's frivolous. So we have developed all of these technologies in order to meet your concerns and parameters. And then for users to adopt this, it has to be very simple. It has to be effective and works when we push a button. And with all of that, we can help people then manage the system once it's implemented and also enhance the adoption so that people are using it. So when you're looking at where you are right now and what kind of risk are you have the potential to experience, it's important to strategize. And not all of what we're talking about today is technology, because this is what the organization has to do. Technology alone is not a panacea. It's the people who make the technology work. And sometimes before technology can even be implemented, we need to have a plan. And that's not sometimes, that's all the time. So things that you can be doing now, and you probably are already doing, are looking at your workplace security, doing safety assessments, determining where the high risk areas are. After you do this, then setting objectives, especially as they relate to training. Over 50% of nurses have stated that they feel that hospital leadership has not supported them in learning about de-escalation techniques and violence prevention in general. So to be able to make that assessment, determine where the gaps are and how you can educate people so that they feel safer while they're at work. You can look at modifying the environment and then RTLS technology, the research as to what will work, what kind of process you want in place, and then the integration can all be planned and can also be done on a rolling type of basis, starting with a proof of concept or looking at those areas that are the highest risk first. And with all of that, we know in healthcare, we are continually assessing and improving. So technology goes in, that doesn't mean that the chapter is closed. We want to be your partner to help you continually improve and learn how we can improve and how we can contribute to help you improve your process. It's good to know that the legislatures in both the US and Canada have been looking at this concern in this issue. It is obviously a significant enough issue that it has been passed in the House of Representatives, and that is the Safety from Violence for Healthcare Employees. That's the SAVE Act. It is now in the Senate. An interesting component of this is not only it provides federal protections for healthcare workers who are victims of violence in the workplace, but it also provides grants to help organizations develop programs to help reduce violence. It can also be used for training, for any coordination with law enforcement, and also for purchasing technology. So that is an interesting gift or incentive that the US government is offering. And in Canada, this issue of workplace violence is also considered significant and a need for action through their revision to Bill C-3. It's illegal to use fear to stop a healthcare worker or those who assist them from performing their duties, from obstructing people to receive care. Anything that is determined that results in a conviction that people have been perpetrating this violence or this obstruction can result up to 10 years in prison. So obviously in Canada, I'd like to say they're not messing around, but they consider this a very significant issue and have taken steps to ensure that people are protected. So there's always a cost associated with everything, a cost for purchasing technology, a cost for doing a risk assessment, a cost for teaching. There's also a cost when we do nothing. When we do nothing, there is a potential that nurses continue to leave the workforce and cause even more significant staff shortages. And again, it's not nurses, they are the most widely reported, but there are people, healthcare professionals in every area of the hospital. What has been the area that has been growing significantly is in the emergency department. The physicians have noted that over the past few years, they are facing increased incidents of violence, possibly 2 to 5 events a year, and that's from ASAP. Despite all of this, as I said before, people don't always report this. So we need to ensure that we have developed that culture of safety where people are able and willing to speak truth to power, to be able to make these reports so that they can feel safe at work and so that their colleagues can feel safe at work. Because once it is known that it's better to stay silent, that is almost insidious. And so it's important that we provide that safe space for people, not only in violence protection, but also in their ability to speak out. It's obvious, we know that it can affect any organization's reputation. We're always seeking to be that employer of choice, that provider of choice. And yet, when people feel unsafe and that kind of news and information hits the media or word of mouth, we can see that our intake, our admissions, our referrals, they tend to start dropping. And so we also need to be thinking about how do we look in the community and how can we improve that so people feel safe and want to be coming to our organization to receive that care excellence that we're striving to give them. And then when people feel unsafe, that directly impacts patient care. It directly impacts patient safety, and we have that responsibility to ensure that people are safe so that they can do the work that they need to do so that the patient who is at the center of all this can receive the care excellence that we have determined is necessary and is part of our mission. There are a number of people who would be using this. We call them personas, but they're people. Any staff member can be carrying a badge around with them. And I put one on today. Often people don't are getting away from lanyards because you don't want something that is around the neck that can be pulled. But this is what it looks like. And look, there's an interesting looking person on there. On the back of this is a button right here, if you can see that. And the person would be pressing that button for 2 seconds, and we will go over it in probably just the next slide. Other people who would be involved in this program and be using and experts in the technology would be the responders, the security and the staff who would be near the incident, who would be responding to calls for assistance. There's a security manager, system manager who can be IT and or security, as well as the badge manager. Now that sounds like an important job, and it is because those people will be monitoring the badges and making sure that people get the replacements that they need when they need them. So when this happens, it's really a 4-step kind of process that happens in just a few seconds. If I'm experiencing an act of violence or intimidation, this badge can be, often people will have it up near their shoulder or near a pocket so as to be able to access it without attracting attention. But for the sake of our talk today, I will be attracting attention and hold it up. So I have a button behind here. I'm going to press that for 2 seconds. That triggers an immediate location-based distress alert. People know who I am and the fact that I need some help. You can see on the back there is a red light that's flashing. You may or may not be able to see that. And then help comes. Assistance is dispatched and help comes to ensure that the person is protected. So it's a very safe, people aren't, we have a graphic here that shows someone holding it up. They're not holding it up to anything. It's really just to show that this is the badge that starts the entire process. And so now we're going to talk a bit more about how it actually works.
Thanks, Joanne. And we'll take a slightly deeper dive here. So that the badge, I have the same one on my lanyard as well. What's nice about that is it can be a very discreet way that you push a button. You could even just be holding your badge and somebody wouldn't even know that behind there was a call for help, and that any ID card slips into that. So you can take your badge out. You can put your access control card in there. That is why this is the preferred form factor. But I am going to show you a couple other choices if you don't. If this isn't the preferred design, we'll show you something else that can work for your facility. So as Joanne mentioned, you hold that for 2 seconds. You'll get the LED light will flash, so you will know that the call has been received. So that is a really key thing. When we talk to individuals and they ask, well, how will I know it's working? Like, how will I know help is coming? And so you need, if you are buying a system, you need to make sure that the badge has some kind of, or the beacon has some kind of audible chirp or a visual light or something so that you know that help is on its way. There's nothing worse than being in a panic situation and then not knowing. So we want to eliminate all uncertainty. So once you've pressed the button, you'll see the LED light on your badge, and then the alarm signal is sent to the cloud software. The devices throughout the facility, so we design, our pre-sales engineers, they will design a plan, where do the gateways need to be located. So this is, a lot of the systems in the past were expensive, a lot of wiring involved. So we've tried to make this, remove the barrier of cost so that hospitals can put this into place in other types of care facilities. This is the AC Bluefy. You'll see it just plugs into the wall. We recommend behind the TV set, in the room or in a discrete location. There's a little safety screw hole there, so you can screw that in so somebody can't easily remove it from the wall socket. So these are very inexpensive and very easy to install. You can cover hospital clinics with these. We also have a device, another gateway that is powered by central power or by power over Ethernet. It's, again, very small and compact. It can go on a wall. We recommend them up in the ceiling, and those would be down the corridors where plugging something into the wall isn't as convenient. You can also plug these in at nurses' stations and other areas where there's wall sockets that are away from patients. If you're working in behavioral health, which is an extremely dangerous place to work in healthcare, probably the highest incidence of issues, we recommend these up. If they're hard ceilings, they're up in a box and out of the way in the ceiling or above the ceiling tiles so that the patients can't tamper with them or cause any harm. The software, we call that Blue Zone. So that's your cloud software, and that is where you're managing who has which badges, where the gateways are located. We can, from Blue Zone, talk to other software in your facility, and we'll talk a little bit about that. So if you are using other technology and you want those alarms to report somewhere else, we can do that for you. And if you are an AllGuard customer, so you're already using the Guard RFID software that you purchase, there's also Staff Safety built into that. You don't need to purchase additional software because you've already made the investment in that product. So we are looking to find every way to make this as cost effective as possible and encourage as many hospitals to do something about this growing violence in healthcare. And as Joanne mentioned, there is a cost to doing nothing. As she said, it just creates a culture around it being, I guess, acceptable in a way, or people just staying silent about things. And we really want to encourage that you use these systems. And the last piece is to look at, there's analytics in these systems, so you can run reports and look and see where are areas that we're having the most issues. Where do these alarms come from? Which individuals, what time of day, what areas of the facility. And I think that is an area where we can encourage the education pieces, go and do some research and figure out how can we make those particular areas that have high incidences safer. There are other things out there in facilities that were put in place, some of them many years ago. Again, systems once upon a time were far more expensive than they are today. Fixed panic buttons, you see these in all kinds of facilities where you have to get to a spot on a wall or pull a cord or do something to get attention. Problem with these things is typically you're not next to one of these when you need it. These can be difficult to use and difficult to maintain because they often are subject to getting damaged. You'll see them in parkades to phones and other things where you can go to them. But again, when you're alone, it's dark, it's night, you're in a parkade, typically your would-be assailant or perpetrator is not necessarily going to stand next to the blue phone where you can call for help. So I think those are a bit of a false sense of security. I think a dedicated badge that somebody can be wearing is a lot more comfortable and gives you a much better peace of mind. Dedicated wireless panic solutions, there are some out there on the market, but they are single use case, which means you can't use them for other things. Joanne mentioned, being able to locate your assets and have staff safety combined into one system. This is cost effective. And they often don't have great coverage or may be relying solely on the Wi-Fi or solely on a cellular coverage, and it may not give you the coverage that you need. We're going to ensure that every area that you identify in your facility, somebody will be able to be located accurately and quickly, and that is the most essential piece. And then the last type of solution was using active RFID, which we use this technology for things like wandering patient and infant security, but they were limited typically to high risk areas. So we would do staff safety with them 20 years ago, 10 years ago, because it was the only technology available, but these systems were more expensive to deploy and to maintain, although highly accurate. Most hospitals didn't have budgets to cover an entire facility using active RFID. And so now with BLE, which is such a game changer, the cost of these systems is, I would say, can be as much as just a tenth of what they used to cost. So there's, this should be a factor that removing this barrier to entry into this market, I think is really key for hospitals. So I'll talk a little bit about this. So we've showed you this badge. Battery life. The battery life, why does it vary on here? Well, it varies because it depends on how often the badge is used, and it depends on what you're using it for. So you can use it to just have alarms, and so that just gives somebody's location when they push for an alarm. So it's not monitoring staff. I know sometimes nurses say, well, I don't want to be followed or monitored or have this breadcrumb trail showing everywhere I've been. So you can set the system just to take the alarms. You can also have the badges where they don't have a person attached to them. They just have a number associated with like an employee number. So you're not able, somebody can't go into the system and find out where somebody specifically is unless you want to do that. So there are ways to make it last longer. It may be varying if you are using it for other things like other solutions for clinical workflow and other applications. It will impact your battery life, but you're going to get at least 12, and you can get as much as 48 months out of these tags. The second one I'm going to show you is a small pendant tag. This one's in a holder, so it can go onto like an expandable, retractable badge holder cord. These are very nice. They're compact. It could be worn on a waistband. It could be worn up on a lapel. It could be on a key fob, like a keychain as well. It can also be worn where you have your ID badge, and this just dangles off the lanyard as well. If you're not wearing a big, heavy ID badge and you just want this on a lanyard. It can be worn that way. And then the last one I've got here, this one is a larger form factor, but when you go to a larger form factor, you also get longer battery life. And this one actually has a replaceable battery. So you pop the back cover off, pop out the battery. This is a very sturdy, durable tag. It's got 2 buttons on either side. I think it looks a little bit like my dog's collar bone. Comes with a holder, a little rubber holder that can also attach to a lanyard or a pull cord, like I just showed you, and it protects it if it gets dropped or bounced off the ground. So that is the 3 form factors. You can mix the deployment. I know some people ask us this, well, can some people have the badge and some people hold the pendant, some people hold the fob? The answer is yes, you can combine those together. So we like to give clinical folks the choice of what works best for them. I showed you these gateways. Just to touch on this, these will work for, so on the right-hand side of the screen, it talks about solutions enabled. So you can use these also for our wayfinding. You can use them for asset management. You can use them for patient workflow. You can use them for staff safety. Why is that important? Because you can spread the cost of the infrastructure across multiple departments, or even across, a corporate budget, or, specific funding. And then I think it's much better than managing different vendors for each use case. You can work with one vendor here, one of our system integrator partners, and then you have the ability to roll these use cases out as you see fit. And one last thing about the Wi-Fi access points is, if you have a newer Wi-Fi network that has Bluetooth low energy enabled access points, you can reduce down the number of the devices that you need, and we can help you maximize, again, another way to save your costs and maximize a technology investment that your IT team may have made in new Wi-Fi infrastructure. We can reduce down the number of devices 30 to 50% by maximizing that Wi-Fi network, and potentially even more depending on what your coverage is. But we will work with your facility. We'll take a look and we'll make sure that the coverage is going to be adequate, and then we can make that recommendation. Another thing that's important, if you have multiple sites, so be careful in choosing a vendor. Make sure that they have what they would call an enterprise or a multi-site architecture, which means you can have multiple clinics, multiple hospitals, multiple buildings on a campus, all using the same infrastructure and deployment, especially when it comes to the software. So in this particular diagram, what we're showing here is you've got multiple facilities. It all comes and aggregates into Blue Zone. It goes to the AllGuard server if you choose to use the AllGuard server, or it can go to a third-party application. So what that means is, if you're using an alarm management software, if you're using an access control software, a nurse call system, and you would like the alarms to go directly into that, so that the security folks are dealing with a single pane of glass and they don't have to go to another application, you can do that. If you're an AllGuard customer today, you can have your alarm show in AllGuard. And then you can have multiple clients, so you can have multiple places for those alarms to go, and we will work with you on that hierarchy of who needs to see the alarms and who will respond to them. So again, there's flexibility there and ways to save on your cost of deployment. If you are using AllGuard or another application, what you would see is an alarm would pop up on the screen showing that somebody was in duress. It would tell you where the location was. And it would show you the time of the alarm, and it won't be silenced until somebody acknowledges that alarm. If nobody acknowledges it, it will escalate until somebody does respond to it. These are an example of some of the applications where you could also have the alarms display. So I'll start with access control. Typically, security will be monitoring your access control system as well. So we're partnered with Linnell and Secure from Software House. So if you wanted those alarms to display in that application, we can do that. We can integrate with a video management system. So some of our technology partners are listed there. What's the benefit of that? Well, if you have an alarm and you want to turn on video cameras in the vicinity, we can do that, and it will record the footage and store that in AllGuard for you. it can be helpful for the law enforcement and security personnel to look at the incident, and if it is a criminal offense and press charges, then you have video to support that and support your staff. We have LDAP and Active Directory for user management for logging in. You can use an alarm management. Most hospitals have an alarm management platform that they're using, so we can send the alarms there as well. And then if you have a nurse call system and you want the alarms to show there, that's also a potential integration that will work well. And again, our when we do that pre-sales and we do that discovery call, our sales team and our pre-sales engineers will cover all that off with you and explain what the benefits are of that, and go through which applications and which version of that software that you're using and make sure it's compatible. As I mentioned at the beginning, everything that we've built is purpose-built for healthcare. So our core use cases today: infant security, wander management, staff safety, asset management, wayfinding. We also do environmental monitoring. All those applications are available today. And we're also in the process of testing. We developed a patient tag, the world's smallest patient tag. So if you want to look at patient workflow, you can use the same infrastructure to monitor your patients. And we're also in some piloting of hand hygiene applications as well. And again, would use the same infrastructure that we've talked about today. Mayo Clinic is one of our largest customers. They've been a fantastic hospital and healthcare system to work with. They've been with us for over 5 years. They have 7,000 employees that they added staff safety badges to. They do use this form factor. It's the most popular one we have. There's a link in this presentation if you'd like to go and read more about that. We'll share that with you. And just as we, just to summarize some of the things that we've talked about today, HID and ASSA ABLOY, the background of the company, and everything we do is around safety and security. That is in our DNA, so to speak. Very IT friendly, so we meet privacy, cybersecurity, compliance. We have folks on the team that are very knowledgeable in helping the IT team fill out those cybersecurity questionnaires and provide the information that they'll need. We have the ability to support multi-site enterprise deployments. As I mentioned, this is extremely low cost to install now, which is great to see. Your staff information would be stored on premise. It's not in our cloud. And you don't even have to assign the badge specifically. We have some hospitals that just have a pool of badges. You come to work, you put one on, you go to work and you use it if you need it, and you take it off and you leave it at the hospital at the end of the day. That's another way to cut down on costs, is a badge sharing program. Or you can assign it just by, say, an employee number or another identifier, or you can put full information in about a staff member if you want to. That's really up to you in your deployment. It's very dependable, it's reliable, and it's expandable to other use cases, which I think is another way to maximize your investment. So we have over 18 years of experience, and I won't read through all these different deployments. They're just there as a reference for you. But what I will say is I just want to talk a little bit about our people that we have there to support you, because it's really the people that I think make our team special and that I'm extremely proud to work with every day. We do have 4 nurses on staff, and they will tell you once a nurse and always a nurse, and they bring that clinical expertise and insights to the rest of the team and help us understand better what it's like to have been at the bedside, to work in a hospital. Our technical folks, some of the people on my team, they go back to when the company, formed and when we started these business units. And so they have such tremendous experience and passion for the product. So the implementation team, the tech support team, we've got hundreds of years, the R&D team, everybody that builds and supports these products based in North America. And they've been with the company for a very long time. And we also have a great sales team, of course, that have been with us for many years as well. But there's just a depth of knowledge, and you'll really enjoy, if you do get the opportunity to work with them on this, enjoy the expertise that we have to help you make this a great deployment. And I'll pass that back to Joanne.
Thanks. We don't need to go over all of these points because we've talked about it at length. From a very high level, we understand that workplace violence is at a crisis point. RTLS technology can help you provide security for your team members, and we want to be able to help you as a partner to provide that safety and security that you have committed to your people. So we've talked about a lot of different things. Fortunately, we're not going to have a quiz on the term definitions, but it's important to think about, with all of this information, what can you do right now? And so right now, and you may be at some level on this pathway, but it's important to assess your environment. Where are the risks? Where would we need to protect our people who are in that potential significant risk zone? It's also important to communicate your commitment to your staff safety to them, get their feedback. We understand that you may have concerns. Ask them for their feedback. Ask them with surveys when you do your rounds, to be able to ask people where they are with this and what kind of situations are they facing, what are their fears. Create your plan for now, what you need to do right now, and then for your optimal state, which is a violence-free care environment to the extent possible, where people feel safe and secure, and where you've developed that culture of safety so that people know that you are committed to them. Training your teams on de-escalation and communication techniques can go very far in their feelings of safety and security and their ability to manage violence in certain situations and circumstances. And then connect. We're here to partner with you to help you determine the right technology. We're here to answer any questions, even if it's just about this process. We're here to support you so that you can provide that safe and secure environment. Your most valuable asset are your people, and they walk out the door every shift, every night. Our job is to ensure that they feel safe walking back in. And we want to help you do that. Thank you so much. Do we have any questions, Matt?
We do have a couple of questions. This one is probably for Carrie. What information does a facility need to provide in order to understand the scope and cost of installing an RTLS system?
Okay, thanks, Matt. Usually we start with some kind of discovery call, so you can tell us about your facility. Floor plans are the most important piece of this, followed by information about your Wi-Fi network and access points. If you don't have that readily available, we can certainly start with the floor plans and give you a design, talk about exactly what Joanne was saying about where are the areas that are vulnerable, where are the areas perhaps that there's incidents that have occurred. And what has prompted it. Typically, unfortunately, it often takes an event to have occurred to spring people into action. So if there is some compelling event, letting us understand what that might be and what you're trying to accomplish with the system, and then other RTLS use cases that you have underway or are considering, so we can help give you the best solution possible. And we give you a deeper dive on the software, show you, specific to your facility, and just, talk about other technologies that you've got and what's the best way to accomplish that.
Okay. Next question, again for Carrie, is cybersecurity an issue with these systems?
There should be no concerns from a cyber. Well, let me back that up. Everybody should be concerned about cybersecurity, and we've certainly seen an increase in attention from IT teams in making sure that the system they are buying is compliant and doesn't create any vulnerabilities on the network. So we will work with them we meet all the compliance with cybersecurity, but there's often paperwork or, a questionnaire or a survey or something that needs completing. So, giving us that in advance, we'll have our technical team go through that and make sure that they are able to answer all questions. And then there sometimes is some legal terminology that needs to go through the legal department as well. And we, again, will meet that compliance.
All right, another question just came in. Is HID RTLS available now direct to the public or only through VAR or distributors?
So good question. We don't typically, we sell through system integrators who do the actual physical installation of the systems on our behalf, whether it's the plugins or doing the wiring in the DC. We do have relationships also direct with the hospital, but we do not just sell it in the open market. You can't buy the components for these systems on Amazon or just through a VAR.
Okay.
We make sure that people go through a training program. So when this has to do with patient safety and staff safety and even safety of your assets, we want to make sure whoever is going to support the system at a local, we still go to site with most partners to make sure a walkthrough is done. We go through to make sure that the system has been site acceptance tested to make sure that there is no weaknesses or vulnerabilities in the system. So unlike other things, perhaps like access control or other things, which HID does sell through a VAR distributor, where people are just buying access cards or RFID tags, passive RFID tags, that's a different market. For this, we want to ensure the safety of people, patients, and assets.
Okay, and here's a clinical question, probably for Joanne. How do we encourage staff adoption of the technology?
Well, that's a great question. That's something that I've researched over time with determining what causes clinicians to adopt health IT, especially nurses. And I found that the biggest contributor to adoption are two different things. And of course, they're very similar. The first is that there is a very visible proponent who is a leader within the organization. And if you're talking about nurses, it's usually the nurse leader, the CNO or CNE, who is a strong and vocal proponent of whatever change is happening, whatever technology is being implemented. That allows people to feel safe and to trust in what's coming next. The other factor that is extremely important is that the nurses need to have a voice in whatever process is being considered. So getting their input, allowing them to test. I've heard so many nurses say, well, I need to touch it to make certain that I know what to do with different things. So to give them that opportunity to have a voice, to understand what is going to be asked of them, and for them to be able to provide feedback, that I found is the most critical factor for success. When people make decisions in a closed room and say, well, I've seen this happen where people say, well, we're just going to ram it down the nurses' throats. That's just not going to work. Make certain that people are engaged, and then you will not receive the pushback that can happen when you implement something. Because if people haven't had a voice to be able to give their thoughts and feedback, the only way they can do that after it's been implemented is to say no, and they won't use it. So think ahead, engage people. It'll create good feelings, and you'll learn a lot from it too.
Good. All right, that seems to be all the questions that we have. Here is here's our contact information if you do want to reach out. We will be following up the webinar in a day or so with the recording of the webinar and some contact information for you as well if you would like to reach out to us. Thank you all for taking the time to be with us today. We appreciate it, and we look forward to talking to you in the future.
Thank you.